This episode is brought to you by Innovative Consulting Group. Since 2002, Innovative has delivered flexible solutions and next level service, helping healthcare facilities nationwide meet their unique HIT challenges. Over the years, Innovative's offerings have grown, but even as its services have expanded, its mission remains the same: to serve as a true partner to clients by providing healthcare's most agile IT solutions. Visit thisweekhealth.com/innovative consulting group. That's innovative consulting group to learn how innovative can help you stay ahead.
Welcome to This Week Health. My name is Bill Russell. I'm a former CIO for a 16 hospital system and creator of This Week Health, where we are dedicated to transforming healthcare one connection at a time. Now, on to our interview.
All right, here we are at Vive 2025, Chile. Vive 25. I started every one with Chile because people are starting to get ready to leave early because they're supposed to get 46 inches of snow tomorrow. I'm here with Dave Dyell with Innovative Consulting Group. We're going to talk a little readiness and application rationalization. It's been an interesting conversation throughout this week for me. Those two topics are really top of mind. AppRat, from the perspective of people are unsure about the budgets. We thought they were stabilizing and they're like, no, I think I'm being asked to cut some more and reduce. Right. AppRat lends itself really well to that. What should people be looking at if they're thinking about application rationalization?
I think the biggest concern people have around application rationalization is the amount of time it typically takes in those projects, right? We're typically looking at a 12 to a 24-month effort. If you talk to any of our peers that are around this floor. But what we've done is we've taken actually some technology and we've tech-enabled our solution. We've added a little bit of AI into it. And so within basically an 8 to 10 week process, we can come in and return a true deliverable to the client that'll really help them see exactly where their application portfolio is today. And then from there, they can start making some decisions about, okay, now what do I want to pull back? Now what do I want to start to rationalize?
I was smiling because our AppRat project, when I did it, started with, let's find all the apps.
Right.
That took at least 6 months.
Exactly.
To find them all. So you have a process that's going to come in, identify those apps, help us to identify the dependencies, the priorities, and then essentially, the other challenge with it is you can't just turn them on.
You've got to figure out whether or not they're going to be replaced, whether or not you can implement something else, right, to replace them, whether you can consolidate. A lot of times it may just be that you overbought too many users in that one application, you don't have enough over in this place, so you're out of license compliance, so you're running a financial risk there, right? So our process looks at all of that to help you understand where your utilization of those applications really is. And then we do actually look at the functionality within inside of those applications. So you may have an ology over here that could benefit from 95% of what they need from this other technology. Is the 5% really worth the cost to have two separate applications? Can we instead combine those two departments on one application, give them both still what they need, and then again, save the organization money?
We have a lot of partners, vendors, whatever you want to call them, at this point, bundling things together. And CIOs have been talking to me about this problem of overlap. Like they're paying for something over here, they're paying for something over here. They're actually using it over here, but they're not using it over here. Is there an approach to that? That's a gnarly problem.
It is, but I think it goes back to those purchasing decisions. So, application rationalization, sure, it's what we're talking about here, right? Coming in and giving that initial deliverable, but it's creating that ongoing process so that over the next, year or 2 years, as different departments are coming to you with needs, those departments are being put through a process to really help identify whether there's something in the application portfolio that already does that. The overlap has occurred because there hasn't been that rationalization process that's occurring in real time while the purchasing is happening. So instead, they end up with this overlap, right? Because this department has bought it for one reason, but to your point, it does 3 other things too. Versus if they had stepped back and run it through a rationalization process, they may have found that there's actually another component of another app over here that does that same thing, and they could have saved the whole purchase to begin with.
I've found over the years that contract management, for whatever reason, is not a disciplined approach in a lot of IT shops. And so when you go in there and say, hey, let's take a look at all the contracts, let's see what we have, because that in and of itself ends up being quite the exercise. I think we've gotten better, but I remember the days where we were talking and people go, I don't know where the contracts are. Some are in legal here, some over here. That needs to be, if you're trying to dial in the numbers, that needs to be a really solid discipline across the organization, doesn't it?
It is, and our application rationalization methodology follows 3 different phases. That first phase is the 8 to 10 weeks that I talk about. Then we go to a second phase where we help you plan out the decommissioning and the archiving and the consolidation. But then that third phase is implementing contract management, Because the other thing that doesn't happen in contract management is SLA management. How many CIOs truly understand all of these SaaS applications they've signed? How many different SLAs they have across them? Are they truly managing those? Are they leaving money on the table because the vendors haven't lived up to the SLAs that they were supposed to, right? So there's a whole component of that happens in our third phase where we really help the organization dig into those contracts, understand those SLAs, see where they're compliant or non-compliant, and then we help them rationalize that as well. And it's pretty shocking how much money you can actually find on the table.
Yeah, I want to get to AI readiness. When I'm talking to CIOs and they're saying, I've been asked for this number, I'm going to do AppRat, I typically say to them, you will get a little bit in the first year, it'll start to grow in the second and third year. Is that fairly accurate, or you shrink the process down significantly?
We do. So we actually do see returns earlier on than those older traditional processes. But also in that methodology, when we deliver that first 8 to 10 weeks, we're going to tell you where the 1 or 2 really hot applications are that can get you the highest savings. And so I think that's what helps shorten that time frame, because then you can focus all your efforts on those 1 or 2, get that $1 million or $2 million added to your bottom line pretty instantaneously, and then go for the longer term, which still can result in 4, 5, 6, 7 additional million, but it really gives you an opportunity to make that initial win up front with those highest dollar returns.
AI readiness, I'm going to be more vague here because I want you to set it up.
Sure.
What does that mean? Is it about helping my health system to understand the requirements of what I'm going to use to do for data? Is it governance around bringing AI applications in? Is it training my staff? What is AI readiness?
So in our opinion, AI readiness is really empowering the CIO with a deliverable. Again, same 8 to 10 week kind of process. All of our methodologies are focused on rapid return to value to these organizations, but it's giving that CIO the ammunition they need to stand in front of their CEO and stand in front of their board and tell them where the organization really is with concrete data. Rather than just walking in there and telling the organization, guys, listen, I know we all want to do AI, but I need time to put in governance. I need time to do this. Our project can come in and really hand them an executive summary that they can take to that board that shows them how unready the organization really is and gives them the ammunition to get the budget they need to prepare the organization for real. That's what we really want to do, is we want to help these CIOs, give them the data that they need to prove to that C-suite, to prove to the board that they are not ready for AI for all these different reasons, and to get the budget dollars allocated they need to then go in and put the processes in place to be ready. All those things you mentioned are important. Governance, right? How are you going to establish governance? Where's that going to be? How does that differ if it's a clinical AI solution versus if it's a customer service solution? Looking at the data. Is it the vendor's data model? Is it aggregated data that's coming from multiple health systems that's forming the basis of that AI model? Or is it going to be built on their data only? And how good is that data depending on which model it's using? And then more importantly, when you start to actually put this in front of clinicians, what's the governance of that going forward to be able to continuously validate and make sure, because don't forget, AI can not only learn the right thing, it can learn the wrong thing, right? So what's the governance model that's going to ensure that the AI model is continuously being managed?
This AI conversation's really fascinating to me in that I say to my team now, and I have some in the past, this phrase of expectations are the mother of all disappointments.
Yes.
What is the expectation of what AI is going to be able to do in healthcare? I think if you're at the board level, they're sitting there hearing all this buzz, they go, oh my gosh, are we applying AI? They don't even know what they just said. Are we applying AI?
Right.
Then you get to the administrative level, and they obviously understand healthcare more.
Right.
And so they're sitting there going, hey, don't screw things up, but we need to implement AI.
Right.
So I'm not sure they even understand what they've asked for, but they're just like, I know that there's a lot of intricacies here that could really create problems for us in the future. What are their expectations, and how do you manage those expectations going into these processes?
The hardest part about this conversation is you're right. Everybody's hearing the buzz. They're hearing their competitors down the street implementing AI, or at least advertising that they're getting ready to implement it, right?
Or at least they got the press release.
That's right, whether they're doing it or not. And so that's giving them pressure to say, we have to do AI too, right? Even if just from a marketing perspective, to say that we're keeping up with our peers down the street to stay competitive, we have to show that we're using AI. So I think that's where a lot of that angst and that pressure is coming from. I don't think that at the board level especially, or even sometimes the CEO level, they know what they want the AI to do yet. That's part of why they need an AI readiness strategy, right? To help them define that. But they do know that they want to do AI. And so that's where I think that angst is coming from, is it's more just from a competitive market perspective of not wanting to be left behind.
Do you help them define the areas where it will have the least risk, most impact?
We do. So that's part of that, again, initial assessment is to really look at what the organizational goals are and where they're trying to go, giving them a chance to plan the AI rollout more strategically. Because if you look around this room today, we're at a great show. There's hundreds of vendors here. As we all know in this industry, we've all been around long enough. There's a lot of them that have AI splattered all over their booth that will not be here in 3 years, will not be here in 4 years, right?
Sure.
And those vendors, because again, it's hard to build a company, right? It's hard to build something with new technology and roll it out. And so for an organization to immediately grab one of these newer, younger vendors, not even know if they're going to survive, slam that solution in, and then find out later on that they're going to go out of business. So you're going to see new AI solutions continuously coming out. So it's better for the organization to step back, plan, get ready, think about where they really want to deploy it, and then go out and look for the vendors that are going to help them actually deliver whatever solution they're looking for. And we don't try to pick and choose where they should be. We're not trying to decide whether it's revenue cycle that they should focus on or whether it's something more around imaging and helping to better read an image. We let the organization decide what their priorities are. We just help them get ready for it.
Closing question. We're sitting here in front of a stage. I don't know which stage that is. I don't know what the name of it is. I'm watching some CIOs up there and whatnot. What are you hearing at the conference? What is the topic of conversation right now, because
we're hearing a lot of angst, candidly. You mentioned that when you first walk up, right? We are hearing a lot of that same angst. This new administration has come in. There's lots of words around Medicare and Medicaid cuts being thrown around everywhere. And as we know, a lot of our facilities live and die on Medicare, right? That is their primary payer, especially in our rural communities. Medicare and Medicaid are their number one payer, right? And so there is a lot of concern around what that is going to do to their budgets and how that's going to allow them to spend. Even our vendor peers here are all concerned about what that's going to do to tightening budgets and if that's going to stop spending, if that's going to have them slow down projects, right? I think that's a lot of the concern in the market right now.
Uncertainty is never a good thing. When
it is not a good thing. Not a good thing.
Dave,
Bill,
thank you very much.
Always a pleasure.
Appreciate it.
Thank you.
Thanks for listening to this Interview in Action episode. If you found value in this, share it with a peer. It's a great chance to discuss and in some cases, start a mentoring relationship. One way you can support the show is to subscribe and leave us a rating. If you could do that, would be great. Thanks for listening. That's all for now.